Good morning everybody, it's Dr Ahmad from the clinic here in Glasgow. Today with me I have a patient who's attended today to have augmentation of her lip area. Upon examination and further questioning, I realised that this patient had had filler about 6 months ago. When assessing the lip to decide what the patient was looking for, we found that there was previous migration of filler causing asymmetry of the lower lip on the left side and also on the upper lip on the left side. I have highlighted this to the patient, and what we are going to do now is a corrective procedure where there is not enough migration there for the filler to be dissolved. It's just small amounts of filler which just causes an asymmetry in the lip. So we're going to inject today, and what we're going to do is we're going to inject, I was looking for the filler but I'll show you guys shortly. What we're going to do is inject using a special technique, because what we want to do is just a global enhancement of the lip, just a bit more definition of the body of the lip and not so much the borders. And we're going to place the filler strategically so that it causes an even distribution of the filler. In addition to that, it will be then used to correct the asymmetry that's there. In order to do this, I'm going to use a special filler, which is this one here. It is called Mildly Define. It is one of the most beautiful fillers that I have used working with correcting lips. And what it does do, it's an oxy-free filler with advanced cross-linking technology. And in addition to this, the filler itself does not migrate and gives a very natural result, very minimal swelling. Another key factor today is that when we're going to inject the lips, we are not going to use any local anaesthetic cream, this numbing cream that they have on the lips, because that makes the lip swell itself prior to injection. And what that does is it hides the actual real shape of the lip, particularly when they've got asymmetry. So what I'm going to do today is place in dental blocks to numb the whole area so that the lip is not swollen, and then once I have the area numbed, I can then work away in correcting the asymmetry and also enhancing the volume of the lip. So just having a look at the lip here just now, what we have got is, we've got overfilling, or I would say a bit of migration from before here, and just along the lower margin there, we've got overfilling up here compared to this side. So what we're going to really be focusing on is just evening that bottom margin up here. So when we're filling the volley, we'll probably pop some filler along the bottom here just to even the margin out, and also we'll probably be avoiding trying to fill that side here and just trying to bring that up a level with that as well. It will be a correction of the asymmetry as well as volumizing the lip at the same time. Okay, so what we have done is we've used a technique where we've tried to increase the volume just at the back end there. We've done this on the upper lip and we're coming back down. With the dental block, are you feeling anything at all?
No.
Not a single thing, it's a total pain-free experience. So what I've done is I've used a technique to increase the volume, but in order to correct over here, in order to correct the asymmetry, I'm going to use a sculpting technique where I'll then be sculpting the lower lip particularly to try and make it a bit more symmetrical than it is from before. We'll show you the pictures afterwards. So what we've done here now, could you open your mouth for me please, Petro? So what we've done is created a really nice even inferior margin of the lip, enhancement of the volume, and we've also done the correction on this side here with both sides over here. So we've got, overall we've got an increase in the volume of the body of the lip, plus we've got a correction of the symmetry, and the patient seems to be very happy. So there we go. Thanks very much folks. Take care.